What is MODAKAFUSP alpha? MODA or TAC 573.
MODAKAFUSP alpha, also known as MODA, is a novel type of cancer treatment. It's a fusion protein that brings together two different molecules, an antibody targeted against a cell surface molecule called CD38 and a hormone called interferon alpha that's usually naturally produced by the body to induce an inflammatory response.
What is the mechanism of action? Is it in trials?
MODA works by targeting interferon signaling to cells that have CD38, which includes both myeloma plasma cells and cells in the immune system. And the neat thing is that interferon is toxic to myeloma cancer cells, but actually provides a stimulatory signal to immune cells, so that we think that MODA can simultaneously kill myeloma cancer cells and induce an immune response against them.
Who is the targeted population? What are the side effects?
MODA is currently in a phase 1/2 trial in patients with very relapsed and refractory multiple myeloma who have been through all of the available effective therapies. The trial is looking at MODA as a single agent for patients with at least 3 prior therapies who have been through everything else. And as a single agent, we think that MODA is overall pretty well tolerated. We do see some low blood counts, especially low white blood cells and platelets, but those have been pretty manageable. And apart from that, and some infusion reactions that happen within the first couple of hours after what is dosed as monthly intravenous dosing, patients in general actually feel pretty well while they're receiving MODA, especially when it's working for their myeloma.
Is MODA considered an immunotherapy?
MODA, or MODAKAFUSP, works by targeting interferon signaling to certain cells. And interferon does work to stimulate immune responses. So we actually think that when we give patients a monthly intravenous infusion of MODAKAFUSP, we can induce immune responses that may help to target the myeloma. It also helps that MODA also targets interferon directly to myeloma cells, which can kill myeloma cells. So we think that dual mechanism of action may be especially powerful.
What is the response rate of MODA?
We presented the results this weekend of 100 patients treated with MODA so far in our trial. And at the dose that we think is going to be effective, we saw that 43% of patients responded to MODA. And that includes patients who previously got treatments targeted against CD38, like daratumumab, and also patients who had been through every other type of treatment that is effective for myeloma, including treatments targeted at BCMA, which are among the newest things that our patients have access to. So we're really excited about the potential for MODA and are planning a larger trial investigating it at 2 doses that we think are both going to be effective. We're just not sure which one is the best one in a large group of patients, and hoping that it moves towards approval.
Thanks for watching. By creating a HealthTree account, you can get exclusive access to the latest HealthTree University content, track your course progress, take quizzes, and bookmark lessons. Visit the links in the description below to get started.